The Russian invasion of Ukraine has unleashed a new crisis, the crisis in healthcare system. Many patients undergoing hospital treatments had to leave their care centers immediately. Many fled to neighboring countries without proper documentation or medical kits. Our next report has all the details on the same. Take a look.
Katya was bringing her 17-year-old daughter, Alinka, who has bone cancer, for an urgent operation when Russia invaded Ukraine. The doctor called them and advised them to turn around and go home for their own safety. Now they are in Warsaw, Poland, awaiting more treatment.
We lived
in a village in the Rivne region, but we were treated at the Cancer Institute in Kyiv. Since we had to interrupt our treatment there because of the war, we were invited to come here. We decided without hesitation because this is not only a war with our occupiers, but also a war for the life of our child.
Katya and Alinka are among more than 1 million people who have fled to Poland from Ukraine to escape the escalating war. 4 million people may ultimately flee, the United Nations has estimated. In wartime, healthcare crises, including a lack of access to hospital and treatment, outbreaks of disease, malnutrition, often kill far more people than bombs and bullets. The fear now is that refugee influx into Ukraine's neighboring countries will push their health systems over the edge too. Ernest Kucha, the head of pediatrics at the Medical University of Warsaw Hospital, said almost every refugee child arriving at his hospital has tested positive for COVID-19.
We can announce that we will treat all Ukrainian children, but I am afraid it is simply unrealistic. So we count on the support of other countries that are larger than us, not to say that they're richer. I know that some children with leukemia went to Italy. Some children went to Germany. Very good. However, we take the first hit on ourselves.
In the short term, international humanitarian agencies, national governments and volunteers are scrambling to send trauma kits, emergency medication and ambulances to border crossing points with Ukraine. But all partners involved in the relief efforts said it was long-term or chronic needs, often among patients arriving without documentation, medication or the ability to speak the local language, that could prove the biggest challenge. Mental health is another area of concern as refugees cope with unthinkable trauma. Katya broke down as she explained the 24-hour journey she made with her daughter to reach the Polish capital, also worrying about the rest of the family still in Ukraine.
Family? My husband stayed behind with 3 children. But let's hope that everything will be quiet, peaceful, and we will go back to Ukraine. To our family, to my children.
WION is now available in your country. Download the app now. Get all the news on the move.